welcome everyone. I am Dolores White, and I have the pleasure of serving as the president for the KNA. Thank you all for attending the KNA Town Hall tonight, and to the Northern Chapter for hosting this event. I'd also like to thank the Governmental Affairs Cabinet for planning and holding the town halls this month. Across the state, there are several events being planned. And I also want to thank the KNA staff for all of the little details that are being taken care of to make these events happen. So thank you, Delano and Kim here tonight, but I know the other staff members are helping as well. And a special thank you to all of our legislators here tonight. We truly appreciate you attending and for your support. The KNA represents and speaks for 90,000 voting Kentucky nurses who make up 53.3% of the healthcare workforce. We want to encourage you to please contact us at any time if you need information or assistance, if we can help in any way. We are happy to serve and be as a resource for you if you have health and healthcare questions. And as you are planning legislative actions that involve nursing and healthcare, we are here to serve. And now I would like to turn this over to our KNA CEO, Delano Manson, who will review the agenda and guidelines for the evening.
Thank you very, very much. I really am delighted to be here for our first town hall for this season. The guidelines for the town hall today is that you will have 2 minutes to provide an answer, and I am the timekeeper from heaven. So I will guide you should you need to stop your communication with the team. And I will raise my finger when you have 15 seconds left. My little finger here. And if you go over your 2 minutes, I will turn off your microphone. Just so that you know. So we want to give everybody an opportunity to respond. And hopefully we'll have some time at the end to allow for questions from the audience. We have 50 some people to register for tonight. They're very excited to hear from you. Other things that I want you to know are we will allow those questions only at the end. So if individuals would like to put questions in the chat box, we will curate those and ask them at the end of the session. And with that said, I'm going to ask that we do introductions, and each of you will have about 1.5 minutes to tell us a little bit about who you are and why you are here being with us tonight. And so, Julie, I'm going to start with you. How's that?
Wow. Okay. Didn't see that coming. I'm Julie Denton, and I'm External Government Affairs for the KNA.
Thank you, Julie. Aaron Curran?
Yes. Hi, my name is Aaron Kern. I'm the Democratic candidate running for House District 65, which is Covington, Edgewood, Fort Wright, Park Hills, and Crestview Hills.
Thank you. Linda Robinson.
Hi, my name is Linda Robinson. I've been a nurse for 37 years in the state of Kentucky, and I am the co-chair of the Government Affairs Committee for the KNA. Thank you for being here.
Terry Hatton.
Yes, my name's Terry Hatton. I'm the candidate for District 67, Northern Campbell County, and I'm excited to be here.
Thank you. Matt Lehman.
Yep, Matt Lehman. I'm the Democratic candidate for House District 67, which is northern and western parts of Campbell County. And thanks for having me tonight.
Absolutely. Marianne Proctor.
Hi, I'm Representative Marianne Proctor. I represent Union in Florence. I've been in the healthcare industry myself as a speech pathologist specializing with neuro patients. So I'm very curious about what you guys have to say tonight and to have a discussion about what's affecting nurses. Thank you for having me.
Outstanding. Thank you. Jennifer Sierra.
Hi, thank you guys for hosting this tonight. I'm looking forward to talking to all of you. My name is Jennifer Sierra, and I am running for State Senate District 23, which is most of Kenton County.
Thank you. Kim Moser.
Hi, Delano. How are you?
Hi, Kim.
So I am Representative Kim Mosier. I have been serving the 64th District, which is Taylor Mill, Independence, a little of Edgewood, Erlanger, Ryland Heights, Latonia, Covington. Since 2016, I chair the Health Services Committee, so I have the privilege of working with many of you. And I am a nurse. I am a retired neonatal intensive care and a flight nurse, and served also as the Northern Kentucky Drug Policy Director for many years. So I'm happy to be here and always happy to work with you.
Thank you. And last but not least, our Zoom master, Kim.
Hi, everyone. I'm Kim Becker with the Kentucky Nurses Association. I am the Associate Administrator. Glad you all are here. Thank you for taking the time, and thank all of our attendees for taking the time to be more educated and vote.
Okay. So now I'd like to turn it over to Linda to talk a little bit about the KNA and our 2024 priorities.
Thank you, Delanor. First, we want to thank everyone for spending part of their evening with us tonight. We're excited and grateful to have you here. We hope this session is valuable for both you and the KNA members joining us today. As you know, nurses are represented in every legislative district across the state. So some of our constituents are here with us tonight, and they're eager to hear from you. Each year, the Kentucky Nurses Association works to improve not only nursing, but the overall healthcare within the state. We do this by volunteering, workforce data collection, the Nurse Emeritus Program, collaborating with other healthcare and professional associations, and setting forth legislative priorities for legislative sessions. These legislative priorities are based upon information review and sharing, evidence-based practice, and research-based policy. They are brought to the KNA's attention not only through resources, but also through submissions from individuals, whether they are nurses, legislators, or private citizens. The KNA accepts proposals for legislative priorities or concerns year-round. To submit a proposal, you can find the form under the advocacy link on the KNA website. We greatly appreciate the legislation for decriminalization of healthcare providers that was passed this year. Kentucky is the first state to pioneer such legislation, and we are looking forward to seeing other states follow our lead. In the 2023 legislative session, the General Assembly passed HB 176, strengthening policies to prevent workplace violence. Data shows just how important this is. 48% of nurses have reported an increase in workplace violence, and over half of those nurses reported injury from violence. We applaud the General Assembly for increasing the safety of all healthcare providers within our great state and working to address the nursing shortage. As you know, Kentucky, as well as the entire United States, has a critical nursing shortage of approximately 36%, or to give another perspective, it will be about 13,000 nurses short by the year 2025. The KNA wants to continue to partner with the General Assembly to implement creative strategies to address these shortages. At this time, the KNA has 3 potential legislative initiatives for the 2025 session. While we don't have specific legislation at this time, our goal is to shine a light on, as well as educate and speak to legislators about these issues. First, the overall healthcare workforce shortage within the Commonwealth. Second, school nurses. And third, sexual assault nurse examiners, or most commonly known as SANE nurses. You will find additional information on these topics in the town hall packet that you received. Please know we will be sharing additional information with you in the near future on these priorities. The KNA supports a number of other issues dealing with recruitment and retention, nurse emeritus programs, making the workforce safer and less stressful, and measures that would make nursing a more appealing career. We work not just with legislators on our priorities, but with other provider associations and groups to collaborate on solutions. Now we'd like to give you all the opportunity to share your thoughts on issues important to Kentucky's nurses. Our lobbyist, as you met, Julie Denton, and I will take turns asking questions, and each of you will have 3 minutes to respond.
Linda, we had a new person to join us, and we would like to give him an opportunity to introduce himself before we get to the piece. And I think 2 minutes is all we're going to be able to give them instead of 3, considering how many we have.
Okay, that's good. Okay, you will each have 2 minutes to respond, and if you need any clarification, let us know. And then Delanor, I can't see who the new person that joined in.
Brandon Long.
Brandon Long.
Would you come on camera and introduce yourself? You have 1.5 minutes to tell us who you are, and then we'll get started with the other questions.
There we go. Hi, everyone. I am Brandon Long, and I was in the peanut gallery apparently until I got promoted. So I'm very glad to join you all up here. I'm a lifelong Kentuckian. I'm a minister and educator and a proud dad. And I'm very excited to make this run for District 68 as the Democrat candidate in Central and Southern Campbell County, particularly to put our kids first. And I'm very, very excited to have this conversation, how we can prioritize the health of our children. So thank you very much for having me.
Thank you.
Julie, I believe you were going to go ahead and start with the first question, please.
All right. We gave you all the first question, more for you to just think about it. And we're not going to ask you to answer this question because unless you're in the healthcare profession or you're in the legislature, you may not have an answer to that. So when we told you that this nursing shortage is critical, and what actions do you think could further be taken to help ensure that nurses aren't overburdened and patient care is not compromised, and we could help with this shortage, we didn't really expect you to answer that, but we just wanted to send that question to you to stimulate some thought. So we're not going to ask one because you probably are looking to us for the answers to how do we do this? And we appreciate that. So the first question is actually going to be the second one that we sent you. Would you support legislation to increase SANES, which is the sexual assault nurse examiners in Kentucky? And would you support funding toward increasing SANES in Kentucky? First, we'll start with Jennifer Sierra, if you could answer the question first this time.
Okay, yes, I would support funding of SANES. I think that's vitally important, especially in the current situation with reproductive health care being such an issue in our state right now, you know, not being a woman's choice, because I do support a woman's choice. And I think it's vitally important that we have those nurses in schools and other areas where they can identify when someone's been molested or taken advantage of, somehow raped, or, you know, whatever the situation is. And I think it's vitally important that we support that and that we support a woman's right to choose.
Thank you. Kim Moser?
Yes, absolutely. I would support finding ways to better train nurses or train nurses to participate in the same nursing specialty, really. And typically this happens in the emergency room when an individual comes in after a sexual assault. And so I'm not exactly sure what the funding would look like, but you know me, I like dissecting problems and finding solutions. So yeah, I mean, if we can find a way to do this and add more SANE nurses, I know that we don't have SANE nurses in every hospital, especially in some of our more rural areas. I think it's also especially important as we try to tackle the human trafficking issue. And we know how valuable our sexual assault nurse examiners can be in those situations. We just heard from SANE nurse at our last health services meeting when we talked about human trafficking. So there are several reasons why we would want to have more SANE nurses. I would absolutely support that.
Thank you. Brandon, feel free to answer the question, please.
I was born in Harlan County, grew up in Central Kentucky, and made Northern Kentucky my home. Each one of those are different areas with different needs and different hospital and healthcare provisions. I absolutely support an increase of SANE nurses across the board, especially in underserved areas like the Appalachian and mountain area that I was born in. Kentucky is 16th in the nation for child abuse. Thankfully, that's going down, but it's 16th in the nation for child abuse. And so therefore we need to do an all-out effort to protect our kids and to provide opportunities for our young girls and young boys as well, which is very important to prioritize as well, who are molested and abused. It's an epidemic that many people, lay people, don't fully recognize. And so I absolutely support an increase in SANE nurses across the board. I fully support increasing funding to train and retain more of these nurses, particularly in those underserved areas, so that every single victim of sexual assault has access to compassionate, timely, and specialized care that they need.
Thank you. Matt?
Yes, 100%. I mean, and I think Brandon mentioned the statistics about childhood sexual violence and the problem we have in Kentucky. I know we're number 2, I believe, in the country for domestic abuse. I mean, this whole situation should be and needs to be a much higher priority in the state of Kentucky, along with a lot of our health issues and mental health issues and dental. And I think as Representative Mosier pointed out, I mean, there's obviously a lot of details about how things get funded and how do you do this appropriately. But it starts with having responsible people who acknowledge a problem, want to make it a priority and work through those issues. But I mean, that's where it starts. I mean, this is very much about the health and well-being of the people of Kentucky, and it has to be a much higher priority than it has been in our past.
Thank you. Marianne?
Yes, I'm supportive of the SANE nurses having them at the hospitals. However, I believe this is a regional and more local issue than doing a state kind of mandate. I'm concerned about when the state gets involved in things like healthcare and doing unfunded mandates, putting that burden on there. I would like to see nurses trained in that. I'd like to see perhaps that there's maybe on-call nurses or areas, because not every area is the same. The demand is not going to be the same across the state. So having that flexibility, and then it comes down to your hospitals. What are they wanting to do? What are they able to do? I'm not sure that the state should be telling them what to do, but I support having more of those nurses.
Thank you. Terry Hatton?
Yes, funding's critical. Funding brings different challenges at different times. There's times that the funding, you utilize it and then you find yourself needing more. I've learned that in small business. So yes, support the funding part of that. Sexual assault safety, coming from a security background, owning a security business, safety is critical. It brings challenges. I serve on a nonprofit board that basically work with homeless in a healthcare environment. And that has a continued concern about safety. So safety, typically the challenges are pretty ongoing, but you've got to adjust with them. And sometimes it's the facility that you're working out of that creates sometimes resolving that challenge, whether it's technology or whether it's upgrading the security environment or communicating with that. But yes, the sexual thing, the workforce shortage really catches my ear. Everybody's experiencing this. So, there has to be ways that creatively you bring I'll say that younger generation into the workforce and helping them connect with that interest in the healthcare industry. For instance, my granddaughter wants to be a nurse. She's a senior in high school, and she's come to me and say, Papa, this is a career field that I want to go, even though we continue to ask her, what are you going to do when you finish high school? And she wants to be a nurse. So exploring that with her, allowing us to basically put her in connection with St. Elizabeth to be introduced during her senior year to some of the options in the nursing field and to help her basically move in that direction. And the shortage, 13,000 is a lot of people. It's a lot of people. So that's a solution that if we don't resolve between now and then, it could become a bigger monster than that in that environment. So that workforce shortage, really catches my ear. Safety's important. There's a way to do that, working with the facilities itself.
Terry,
yes.
Thank you so much, but your time is up.
All right.
Thank you. Aaron?
Hi, thank you. Yeah, I do support increase in SANE nurses, specifically through legislation. As an attorney, I do a lot of criminal defense work, and I understand the importance of having as little contact with from the victim to the forensic examiner as possible, so you can get as good a possible examination, as well as not making sure that all the evidence is protected. And I think doing it as quickly as possible is ideal. So I do support that, and I know this firsthand where it's not as big of a problem up here in Northern Kentucky because there's quite a few SANE nurses. However, once you get outside in the rural areas, it gets harder and harder to do that. And just because one specific region has it doesn't necessarily mean that there's not a need for statewide legislation. And I think on top of the statewide legislation, I think for me, from an evidentiary perspective, because that's where I look at everything, is having some type of protocols in place when you're doing that to make sure that the SANE nursing training is the same throughout the state and that those procedures are followed and that they're evidence-based. Lastly, and I think the SANE nurse issue is a bigger problem of a lot of times we get these rape exams because there's such a backlog at the laboratory that you might sit there and take a year and a half for those to get tested. So it's just delaying everything and not allowing the case to be tried and not allowing the victims to receive justice the way they need to. So I would absolutely support that.
Thank you. And we just had Willanne Stengel join us. And if you could give us an intro to yourself, so we'll give you extra time to do your intro. Plus, I'll read the question to you once you're finished introducing yourself.
My name is Willanne Stengel, and I am the Democrat candidate for state representative in District 69, which is in Northern Kentucky, Florence, Erlanger, and Ellesmere area. And I have been very interested in reading the literature or what you sent to me about your meeting tonight. I'm running because I'm very concerned about a lot of the issues that I think you're concerned with and have to be concerned with in your line of work. The medical care for women is a priority, healthcare, reproductive healthcare, and some of this with the SANE kits and examinations that plays into a lot of what we're going to have if we have exemptions for rape and incest. Those are going to be very important aspects of those kind of things, if that is what we're left with when all is said and done. So I'm very glad to join you all today and very interested in hearing more of what you've got going on here.
Great. Okay. The question that everyone was answering when you came into the Zoom was, would you support legislation to increase SANEs in Kentucky, which are the sexual assault nurse examiners? And would you support funding toward increasing the number of SANEs in Kentucky?
Yes, I definitely would. And that was what I was already alluding to, having come in midstream here. Yes, I definitely would. I think it's important anyway. I mean, and I heard Aaron talking, just from a legal standpoint, it's important that we're getting justice for people and that those things are properly done and those things are available readily, and having somebody there to do that when it's needed. But it's even more important now when we have the threat of reproductive care being parceled out based on different extenuating circumstances that we have to be established both legally and medically, or may need to be even more so under these circumstances. So yes, I would definitely be supporting that. I think that's a very much needed and necessary thing that we need to have.
All right, thank you. We've also been joined by Matthew Nunn. I know some of you had to join the slate because it's campaign season and people have multiple places to be at all times. And so, Matthew, if you want to go ahead and introduce yourself, and then you can answer the question.
Hey, thank you for allowing me to join late. I apologize. My name is Matt Nunn. I'm the Republican nominee for State Senate District 17, which is the district that Damon Thayer is currently senator in. You know, I decided to run for this Senate seat because it was very important to me that we had someone, number one, conservative values, but also an ability to get things done. And I felt like I checked both of those boxes. I'll tell you real briefly why I feel like I checked the second box. I've got a lengthy career in the corporate world, holding multiple roles at 22 America. I'm currently the Vice President of Enterprise Risk Management. I also have a long military career. I retired in 2021 after almost 21 years of service. The last 8 years of that working in Joint Force Headquarters in Frankfort, where we're supporting the entire Kentucky Army National Guard across the state. And then my wife and I also own a small business. We've done that for 8 years. We're in an Irish pub on Main Street in Georgetown. So I understand what it's like to sign the front of a paycheck as a small business owner. I understand what corporate America needs to be successful. And I understand what, our first responders and military and folks like that looks like. So I think that helps me look at an issue from a variety of perspectives. To answer the question, I think it was about SANEs, correct? Is that what I heard?
Yes. Do you support,
I absolutely do. And when I saw this, I reached out to someone I met on the trail, Jenna Cassidy. You all may know Jenna. And so I got an education from her, and she actually connected me with someone who is a SANE. And so I heard a lot about what they do. And so I absolutely support that for a multitude of reasons. Number one, so victims can get the critical care that they need from someone who, fully understands how to do that in an empathetic way. I think that's very important. But also to help us with prosecution rates. I think when we have SANEs that are involved in the process, it helps prosecutors do their job. And that's obviously very important in that situation. So those are two reasons why I would absolutely support it. And then talking to the SANE that I spoke with, she mentioned a couple of things that she believes that would be effective to help. Number one, she talked about more for what she called forensic education in the nursing programs. She feels like that would help future nurses just be aware of what that looks like and the need for it, and maybe also remove some apprehension from them. And then the second thing, she talked about telesafe and having a sane, maybe remote in at times when they couldn't be physically there, and do a joint effort with a quote unquote regular nurse. I don't know if that's the right terminology, but so if we couldn't have a sane in the room, the sane could be there by virtually kind of coaching the nurse through that process is an idea that she shared. So those are the kinds of things I like. I like creative solutions to problems, and so those are the kind of things that I would always support and want to look into.
All right, thank you very much. And I'll turn it over to Linda for what will be question 3, but really question 2, since we're not doing the first one.
All right, so the next question is, what are your thoughts regarding a full-time nurse in every school? And do you support funding assistance from the state back to school districts to help cover the cost? And we'll start with Matt Lehman.
Yeah, thanks for that. Yes, I would be supportive of that. Again, at a high level, I've worked in the healthcare field for 24 years, everything from research to development to help supporting surgical programs, and not so much in the schools, but and I've done this around the country. I mean, I've been to hospitals all over the country, and Kentucky, we have a real problem. We are not doing well with delivering quality, affordable healthcare. I actually I got transferred to California for 2 years with work. When I moved back, and I was self-employed at the time, the only thing that cost more in Kentucky than California was my monthly health care as as an individual payer. So it's again, I know we're talking about getting nurses into schools. Yes, I'm supportive of it because we are not finding ways to treat people in this state, and the state does need funding for this. The specific mechanism for how this is funded, whether it goes through the SEEK formula to the schools to compensate it, or there's another program. I mean, again, I think the mechanics of those details can be worked out. But yes, I think, again, this, like sane nurses, having, nurses and also nurses that can transfer to mental health care need providers in schools would be a very high priority.
Thank you. Kim Mosier.
Yes, thank you. I appreciate that question very much because I have done a little bit of work in this area with the state plan amendment, which we have in Kentucky. And that is a program that it's really a demonstration program that allows Kentucky to use Medicaid dollars to reimburse advanced practice nurses anyway in schools, in a school-based healthcare center. And so I would be very in favor of course, ideally, I think we should have a school nurse in every school. But because of the workforce shortages and because of staffing, it's really impossible at this point. It's just, we don't have the bodies. And so how do we find ways to extend that care, that really needed care, to our students, whether it's their mental health needs or other behavioral health or other health needs that arise during the school day? Having that school-based healthcare center really it's so important because we see families struggling to get their children to a doctor anyway, or to see their advanced practice nurse anyway. And if we can deliver that service during the school day, whether it's in person or through telehealth and a referral, to really triage the student to see what the problem is, we can reduce the time that a parent would have to leave work, for example, to come and pick up their child, take them to the doctor, and we can really help streamline this whole process with the school-based health centers and doing it through telehealth. So I would really encourage, and I've worked with the cabinet on this, I would love an update to kind of see where we are, because we don't need a brick and mortar healthcare system in every school. What we need is a nurse or behavioral health specialist on call when that student needs help. So I really love our school-based health centers. Doing things electronically is not always first choice, but certainly it's a referral to the resources that a student needs, whether it's, I don't know, allergy medicine, or they have an ear infection or some reason why they might need to leave school. And if we can deliver that care in person and make those strong connections through our
Representative Mosier, your time is up.
Okay, all right.
Thank you. Aaron Curran.
Thank you. Yes, I absolutely would support increased school nurses as well as funding for that. I think the second part of the question, which was the support funding assistance to the state back to the school, I think is a very important issue, specifically because I think just from a safety perspective and just the school day perspective, it's very easy if you have a kid that's got the sniffles or something to be able to sit there and say, go down to the school nurse, get a quick test, especially with these easily transmitted diseases. So you can kind of identify whether they have something and send them home or do what you need to do so it doesn't spread throughout the school. So I think it would help the school going long term. But I want to kind of get back to the second part of it is where, and right now in this day and age where we are cutting funding a lot of times with schools, and this is actually coming up with Amendment 2, I believe, where you have some schools that spend more of their money on educating, and some of the other schools, especially in more rural and lower income schools, where they are carrying more of the weight of like a lot of the non-teaching stuff, where it might be social schools, social issues and whatnot. You have like sometimes a lot of these kids don't have access to hospitals and doctors because of lack of insurance. And I think increasing Medicaid for that would be helpful because it allows them to be able to kind of do that. And I think giving money back to the schools, it's kind of more of a transparent way of sitting there saying, okay, this is the amount of money that's going to schools for teaching. This is the amount of money that's going to school for like taking care of the children and feeding them to make sure that they can get through the day safe and healthy. I think doing that would be helpful because it would put those schools on a more even footing so they can use more of their money for educating rather than some of the other stuff where maybe some of the other schools don't.
Thank you. Jennifer Sierra.
Yes, I do support having a school nurse. I have to go back to kind of what Matt said as far as, can we afford it? I mean, we did have the biggest surplus in our state budget this year, and I think that we can afford it, not being in the state legislature, to be able to see those numbers for myself. It's easy to kind of be an armchair quarterback here. I do see the need for it. Lots of these kids, this is the first opportunity that they'll have to go to the doctor, and many of them can't afford healthcare coverage. I think Kim even touched on this too. I mean, if we can afford it, I think it's like the ideal situation, and I basically would support it. And there is a need in our state, especially in rural communities or lower income urban communities. And I feel very strongly that that's a good idea. I grew up in an era where we had a school nurse. So it's helpful, especially like Aaron said, in a day of communicable diseases, it's really helpful.
Thank you. Marianne Proctor.
Yeah, thank you. So this was a big education experience for me. I talked to some of our school nurses and really got to understand the demands that are in the schools. So given that, it sounds like it would be ideal to have a nurse in every school. I'm not sure the possibility of that. And I think we have to look at creative ways, innovative ways of delivering those services. My understanding is that perhaps if the coordinators were better able to manage the load, some schools are really busy where some people aren't as much, maybe distributing that a little bit to make that work. But I think it's very important. And just like we put money into SROs to keep our kids safe, this is something I think that we need to look at as one of the issues that perhaps we should be doing in the schools. So I am supportive of the school nurses. I really, it was shocking to me all the things that they do and the critical role that they provide. So given that, it certainly changes or enlightens my perspective on that. So I better understand the need.
Thank you. Matthew Nunn.
Obviously, school nurses have the opportunity to be very impactful and can be a great benefit. In a perfect world, we're able to fund everything at the school that we could possibly want or need, and that would be great. But we all understand that there's limitations to a state budget, just like there's limitations to a family budget. And so I think what I would lean towards is allowing local control to decide this. That's my general disposition on things, my general posture. I think decisions are best made at the local level. I've learned that throughout my career, and again, in a corporate arena where we have locations across the country, and what works in one or is necessary in one might not be necessary in another. So I think I would lean towards allowing local control there and let them decide where best to put their dollars. One thing that I would want us to look at, and someone mentioned SOR, Marianne just mentioned SROs just now, I think, we have the Guardian program that allowed retired veterans and retired law enforcement officers to come back as SROs. We have a workforce shortage in the state. So maybe we could look at some sort of program that will allow retired nurses or something like that to come back and work in a school setting. Could be a win in a lot of different ways. Again, a creative solution to a problem. So I don't look there, but again, I would want to defer and leave a decision like that up to the local school. For example, in Scott County, we have two situations where we have like a campus type setting where there's more than one school located next door to each other. They may decide that a nurse in every school isn't necessary, and they'd rather use that funding some other way. So again, that's just an example of why I tend to lean towards local control on issues like that.
Great, thank you. Brandon Long?
We are the Commonwealth. We are the Commonwealth of Kentucky, which means what happens to one child, like when I was born in Harlan County, affects us all. I did not have a school nurse in Harlan County, only got one in Central Kentucky when we moved there. And then my sons, thankfully, in the public schools have one up here in Northern Kentucky. School nurses serve mental, physical, and emotional needs, which is very important in today's world. We just experienced the school shooting in Atlanta a few days ago, and it's the eyes and the heart of school nurses that can identify that and can also identify victims of abuse. So it actually benefits all of our children in every part of the state of Kentucky to have a nurse there. It really does. Now, I talked to a school nurse here in Alexandria who told me she's not a school nurse anymore because of the toxic culture that has been produced by this current legislature and their attack on education and their attack on the healthcare workers. We've got to do everything possible to support our healthcare workers, and that includes school nurses, for the benefit of all of our kids. And that all means all of our kids in Kentucky. The state should provide the necessary funding to ensure every school has a nurse or staff full-time for the emotional, mental, and physical needs of these children. And with Kentucky facing alarming rates of childhood illnesses and abuse, asthma, diabetes, mental health challenges, this is not just an investment in our kids' health, but in an investment in their ability to learn and thrive, an investment in Kentucky's future as a whole. So let's stand with our school nurses. Let's get them in every single school. In Everett, Kentucky, where I was at, in Fort Thomas, right here where my sons are at, for the benefit of all of our kids.
Thank you. Will Ann Stengel?
Yes, I am very much in favor of we must have school nurses. And like Brandon just said, I realize that there are financial limits on what we can do in a lot of situations, but if at all possible, we need school nurses in every school. I'm former school librarian. In the last school where I worked, I was across the hall from the nursing station, and I got to witness all day what I thought I understood, but didn't fully understand until I was right across the hall from it. There's so many kids coming into schools that have health issues. Brandon mentioned asthma. Asthma is huge in schools, especially in elementary kids. And you also have children that are taking medication that has to be administered by a nurse. You have illnesses that erupt. You have injuries that erupt. You have mental health crises that erupt. There's so many things, and we already have an overloaded education system in terms of what our teachers are able to do. And our school secretaries, even, you can't have school secretaries giving out medication properly. They shouldn't be doing it. That's not what their training has led them to do. And it's these kinds of things are important that they're done properly and safely for our students to create an atmosphere where they can learn. And lastly, I want to say another problem we are seeing is because of the lack of childcare options for a lot of parents. You see a lot of children coming into school each day that really should be home because they're ill, but there's no options for their parents. And so you see a lot of illness and issues that having a nurse there is critical for the functioning of the school and for the proper care and education of our students.
Thank you. Terry Hatton?
Yeah, thank you. Yeah, nursing in schools, yes, I do support. A school-based healthcare system is critical. I was fortunate in grade school we had a school nurse, but in high school we did not. So that frontline support is critical. Someone there that can basically, I'll say, monitor those daily or as needed challenges that comes up. Mental health seems to be a growing concern. The basic medical needs, it can be very helpful. The system would need to be basically allowing us to grow into, I'll say, from a part-time need to a full-time need in those schools that do not have it. Some of them already have it in place, so creative ideals on how to do this, it needs to be ongoing and also looking at the local need. One of the topics is you may have a campus where there's multiple schools and maybe one nurse or one full-time and part-time can maintain that campus. But then you have the ones that are scattered that need more than one or part-time. Coming from a security standpoint, just from a safety standpoint, a SRO, a school resource officer, helps with safety. A nurse can help with healthcare. They go hand in hand. That SRO is focused on safety, and they're interacting with the students and also creating that environment. The nurse is going to do the same thing, and I think it's a critical part of the school system, and also allowing the schools to grow and to protect the ongoing challenges. Whether in the past it's COVID or whatever it may be, with various challenges that we face coming up, whether it's a temporary challenge or ongoing challenge. But one of the biggest concerns is the basic health needs, mental health, and yes, once again, I believe a school-based healthcare is critical in every school throughout the state of Kentucky.
Thank you very much. Okay, Julie.
So what we want to do now is kind of take the things we've been talking about. We've talked to, some people have talked about the shortage. We've talked about SANES. We've talked about school nurses, and we've heard, different things tonight, different ideas, different perspectives. And so what we'd like to do is to give each of you the opportunity to add anything to any of those three things that you'd like to add that you didn't have time for or didn't get to for whatever reason the first time around. So this time we'll start with Marianne Proctor first.
Well, thank you. I really feel like I said all I needed to.
You don't have to if you don't want to,
Yeah,
but this is your opportunity if you want to say anything.
No, I appreciate the opportunity, but yeah, I've stated my points. Thank you.
Okay, great. Willaine Stengel.
I just want to reiterate, I think healthcare is such a critical issue in our state, and I think we're seeing a lot of scarcity of healthcare resources, particularly in rural and inner city areas, and having trained staff available for all of those needs. The sane staff is just imperative in the present climate in particular. And those school nurses, I cannot tell you how lost a school is on a day when the school nurse isn't there. If perhaps they're sick themselves. They provide so many services, and I will tell you right off, I got sent to the emergency room out of the school where I was working because I had to see the school nurse in an emergency. It made a difference for me, and it's so critical for these kids. And you just do not want non-medical staff handling some of these critical health needs. I firmly support these things, and I think we need to make the resources available. That should be a priority.
Okay, great. Aaron Curran.
See, I would like to, I kind of, when I was prepared for the first question, so I'll kind of just talk about that. I think one of the things, as far as I think an issue that I think is important in the nursing field, my wife's a 15-year nurse. She'd worked in all various avenues of it, ICU, telemetry, all of it. And now she's transitioned over to teaching. So she's kind of seen every avenue of it at multiple hospitals in multiple states. And one of the things that she talks about a lot is that, and I know not many states have it, but I think having a conversation about it would be, I think one of the ways of dealing with the nursing shortage as well as the burnout is to maybe start having a conversation about what type of patient-nurse ratios does it look like? Is it mandated, or do we just have like guidelines? And these are based on safe patient ratios based upon the individual unit acuity. So I don't think it's one size fits all. I think it's going to be different for ICU as opposed to med surg and telemetry. But I do believe we need to start having that conversation because it's largely now left up to each individual hospital. And the problem is it does not allow nurses to have any recourse if they feel like it's not safe. And that'll also allow them to have uninterrupted breaks as well as lunch hours where they don't have to be taking care of patients as well as having like a telephone or anything like that. So they can just kind of take some time on the breaks as well as lunch to recharge. And the last thing I like to do, and it's something I actually forgot to mention in the SANE exam, and I just want to kind of mention that. I do think these are most important, I think, for evidentiary perspectives, as well as these are extremely intrusive exams. You want to make sure that when you're doing it right the first time, that it's done according to policy and procedure, understanding how this affects the victim, because these are extremely intrusive exams. So you want to make sure that you're handling it properly as quickly as possible and making sure you're doing all an understanding of the situation that they're in. So thank you very much for asking me to come in, and that's all I have to say for now.
Thanks, we appreciate that. And I will say real quickly, just as a plug for what KNA is doing currently with KHA, is trying to address the issue of having nurse staffing committees at each hospital. So that is something that we've looked at, and you're right, one size does not fit all in terms of staffing, but we're working with the hospital association to work on nurses being at the table to help set what those staffings will be at their hospitals and in each floor or unit. So thank you.
Julie, I would like to add to that, in that the Kentucky Nurses Association does not support ratios. And here's the reason why. As you said, not everything fits right in there. What we know is it depends on what the needs are of the patient and the skill of the nurse as to how those assignments should be made. And it cannot be done by the numbers, because the numbers don't tell the story. It's the acuity of the patient and the skill level of the nurse. Our national organization is in full support of ratios, but the Kentucky Nurses Association, based on the rural hospitals that we have, we know that if there are mandated ratios, many of those hospitals will not be able to comply. And that what we should be focusing on is, what does the patient need? And what does the nurse have to offer? And what other healthcare providers can assist other than doing ratios? That is the KNA position.
And your 2 minutes are up.
Thank you.
Sorry, I couldn't resist.
Thank you.
All right, Jennifer Sierra.
So I have a lot of friends that are nurses, and I've had this discussion with them, especially recently, with the nursing shortage and, and COVID, the pressures of the pandemic on the medical field. And I will say that one of the things that I'm focused on is the quality of nurses that are coming out of schools. How prepared are they? I have a neighbor who's one of my best friends, and she was a teacher at Northern Kentucky University. She was a professor there in the nursing school. And she said some of the people getting pushed through the school were not prepared to really be nurses. But the shortage is causing a lot of people to be accept subpar nurses, people that aren't really prepared, that didn't get quite the education that they should to go into the field and handle patients. And all of these things, it's because of the shortage, people left the industry. Now these younger people are coming into the industry, and they're being forced through the educational system unprepared. So that was one of the things that interested me, as far as looking at this from a candidate standpoint, is how do we mitigate that problem and make sure that the quality of nurses, that these people just aren't placeholders in the industry, that they're able to deliver good care and take the stress off of the other experienced nurses who need to go on vacation, who need a break. It's another angle aside from funding from the state level, is how do you kind of reverse engineer this so that we're encouraging kids to go into the field and encouraging them to be at the top of their game and providing that to them. So that is something I'm thinking about. I don't have all the answers, but those are things that I'm thinking about as a layperson.
I'm going to take a license on a minute. And what I'm going to say is, you are absolutely right. But one of the things that the KNA has looked at is, how can we pay faculty at the nursing schools more so that they don't have to leave their positions as faculty, meaning that there's a hole and they cannot provide the education and training for those nurses. So faculty pay is something that we really need to look at and to consider if we want the faculty to stay. So many of our faculty in Kentucky that get paid $40,000 a year. They can't survive on that. And so what do we need to do as a state to help increase the salaries for the faculty would be one way to address the issue. There is a federal program that has been suggested that would be a one-time program that schools could apply for, which would provide them with monies for a 5-year period, but they would have to build their program to be able to afford it after that. But it would allow them to hire faculty and to increase salaries. So we'll see if that goes anywhere.
Well, you get what you pay for. So, I agree with you there.
Can I just add as well, Jennifer, when you think about those nurses that are coming out, if they don't feel prepared, the KNA does work to look at recruitment and retention of nurses. We don't want nurses to come out into the community and then leave to non-traditional roles. We want them to be supported and mentored and grow in those positions. So again, you're hitting a lot of things on the head. And so those are all things that we are working on in the state of Kentucky.
Well, and this question is doing what we had when we sat down and put these questions together, is doing what we had hoped, and that was to kind of generate some conversation so that as you guys talk about your positions and your thoughts, we can kind of tell you where we're coming from the KNA perspective. So next is Matt Lehman.
Yeah, thank you. I mean, the one, certainly the nursing shortage is every group I've talked to this year is having the same issue, from the iron workers to the teachers, to the nurses. On one hand, we have a state that, is the economic development, the economic growth of the state has taken off, and we're seeing new companies coming and investing. What we're not doing well, in my opinion, and I think one of the biggest jobs of our legislature is it's the responsibility to make Kentucky a good place to work, live, raise a family. And we compete against other states, Ohio, Indiana, Tennessee, et cetera. And we are failing on a lot of measures when we look at our states surrounding us. My goal is, when my priorities in this, and it's certainly very specifically with nurses, is to find ways to make sure you have, and again, this is to address the shortage, is make sure you have safe working conditions, and there has been some movement on that in recent legislative sessions. So I that should be applauded, but there's a lot more to do to make sure it's safe from just a physical safety perspective. But as we were just talking about, making sure nurses are prepared and well educated, making sure you're fairly compensated. And again, we are not competing well with our neighbor, especially in Northern Kentucky. You're going to get paid better in Cincinnati than you are in Northern Kentucky hospitals. And that's a fact. A lot of that has to do with Medicaid rates and Medicaid reimbursement. And there is a faction in Frankfort that has been pushing to push 600,000 people off of Connect in Kentucky. And there's people that are attacking our Certificate of Need program. And look, these are the systems that are providing for the health of our citizens. They're not funded appropriately, and that's coming out in the types of rates that we're paying to our professionals. And the last thing, like I said, my last priority in this area is making sure you have the government, the legislature that is actually respecting the professional expertise, your education, and your training, instead of constantly questioning, our professions in this state, making life more difficult, adding bureaucracy, dangling the threat of felony charges over our healthcare professionals when they're trying to treat women. These things make the job less pleasant. There's also the non-governmental middlemen that make life unpleasant. I don't know if it's money, prescription with on the phone arguing with insurance, try to get the best coverage. So finding ways, again, that will respect the professional education experience and training that you bring, and supporting that, and not constantly questioning and attacking it. But these are the types of things I think we could do, to help make, bring more nurses into Kentucky.
Great, thank you. Brandon.
I would like to add something to bringing more nurses into Kentucky. Passing the decriminalization bill for healthcare providers has done a lot to make Kentucky very attractive to surrounding states. in being the first in the country. We have been asked by Massachusetts and Virginia, how did you do that? Can you help us? We want to do that. And part of what they say, and they're really honest, we don't want to lose our nurses to you. So I think that the votes of those on that particular bill did a lot to help nurses feel, first of all, protected for human error, not for errors that are intentional and that harm people. And I think that that's a very important factor to discuss. Wouldn't you agree, Julie?
Yes, and it didn't just cover nurses, it covered all healthcare professionals, frontline healthcare workers. So whether it's a pharmacist or a doctor or a PT or an OT, they're all covered by this. And being the first in the country to pass something like that was pretty cool. Pretty cool. Brandon Long.
Legislation has consequences. Rhetoric has consequences. Government intervention into medical decisions have consequences. It creates a culture, and it can create a toxic culture that alienates people from wanting to participate, to move in, and to be there. It's the opposite of good old-fashioned Kentucky Southern hospitality, and it's what we've been seeing in the current legislature. In order to, it's been mentioned several times, a shortage across the board. It is across the board because we have created a culture that, as a millennial, I've seen a whole lot of my friends export it to other states across the country because they don't want to be here. They don't want the toxic environment that they are in. We've got to be aware of that. Our nurses over the past 4 years have shown above and beyond that they are the backbone of our healthcare system. It's been amazing, but at the same time, they've been facing again and again conspiracy and conflict and resistance and physical attacks. You've seen it, you've experienced it, and it's wrong. In order to actually recruit nurses, we've got to create an environment conducive for them. And that also means actually having an environment and a system where we have really good nursing educators to teach the good nurses. And as was mentioned earlier, a fair pay for those. As a teacher myself, I know the best way to educate is good funded educators. And that's what we need with nurses as well. Good funded nursing educators. It's also very important that we realize that nurses are not a second class in healthcare, not at all. But there's that stigma and that confrontation over the past 4 years and the pandemic that needs to be confronted head on. There are segments in the legislature that, because of conspiracy and other reasons, have harmed our nurses. And we've got to do the opposite of that. These are our heroes. They need protected. They need uplifted. They need elevated. I mean, there's also a reason, like I said, legislation has consequence. And as we know, 76 out of 120 counties in Kentucky have no OBGYN right now. Legislation has consequences. And so we need legislators that have the back of our healthcare professionals and not trying to confront them and create conflict with them.
Thank you. Terry Hatton.
Thank you for having me with you tonight. And I'll kind of like zero in on this. You know, the biggest concerns with all the challenges I'm seeing is the shortage. The shortage is critical. It's just so critical that we can retain what we have in place. That's important. Competing with the surrounding states. That's also so important. And retaining and growing the future of the nursing industry, whether it's with the existing educational programs that are in place, with intern programs, it's number one. And it is critical that we create that solution to allow us to retain so the shortage does not fall short going forward. And it's also critical that we can grow it with the school-based nursing system. But, you know, from a small business standpoint, I've learned that we've got to communicate. We've got to look at the challenge. The challenge changes. And we basically have to be, from our standpoint, accessible to you to help you resolve the concerns and to be able to compete, whether it's income, whether it's benefits, whether it's educational, whatever it may be different this year than it was last year and next year. So we have to look at the challenge and looking at what works and what's not working. You know, the intern programs, retaining those senior nurses, you know, looking at the local educational programs. It's just, it all comes together in each region and each area has a little different challenge, but there is that core of what it is. So I stand with you. I make myself from a small business standpoint available to hear what's needed and go to Frankfurt and make it happen and communicate. And that's the reason that I've volunteered to do this. So once again, thank you. This has been very rewarding for me to hear all these challenges, and I look forward to working with you. Again, thank you.
Julie,
Yes.
would it be possible for Dolores to speak a little bit to some of his comments in relation to the nurse legislator engagement program and how
Oh, that
we
would be
can be a
great.
resource? We can be a resource to legislators. Dolores, are you back with us?
I am. I'm sorry. I had to run for a student meeting, but I'm back. Certainly, I can share our nurse legislator engagement program. That is something that we started, goodness, 2022. And we set a goal to pair KNA members with each and every one of our 138 Kentucky state legislators. And that way we can serve as a resource for you all. We can provide information. We can share our expertise and experience with you, because we know you are working very diligently for us, and we would be honored to partner with you, again, serve as a resource and assist you as you need it. So right now we have 85 nurses paired with legislators across the state. There are still a few that we need to pair, but we went way past our initial goal. Our initial goal was to hit 50, and we're very proud that we had 85 of our nurses step up. So we are continuing to recruit nurses in this program, and it's gone very well. We've had many legislators report back that they very much appreciate the nurse that has worked to build a relationship with them and to serve as a resource. So I know some of you are, candidates, and some of you are legislators. Just know this is something we are working to do, to have a nurse partner for you so that we can assist you. And then in the meantime, if you're not paired, you can always reach out to us anytime. If you have questions or concerns, we are here to serve you.
Great. That was a great way to slide that in there, because I know you've worked really hard on this, Dolores, and it's important. I think it's just a really important program. Matthew Nunn.
Well, first of all, I've got to say, excuse this giant Dr. Pepper that I'm sitting here sipping on. I feel like a hypocrite talking about healthcare issues as I drink a Dr. Pepper. I've got a quarter pounder next to me that I'm about to eat. That's life on the campaign trail. One of the roles that I served in Toyota Show America was I was vice president of human resources for our North American operations for a little over 4 years. The reason I bring that up, there's two reasons actually. Number one, when we had a location that had issues with recruiting and retention, we would go and investigate the problem. And it was never just one thing. It was always multiple things that caused that. And so I'm hearing that, and I've learned, before joining this call, but also we talked about a couple of things. The legislature has a good and appropriate role in solving some of those issues. We talked about protection from human error, very important. Talked about, protection or legislation to protect individuals from workplace violence, which I understand is a very big issue in your field. And so that's the exact appropriate role of legislators. And so I'm glad that work has been done, and I'd be happy to work with the KNA when the legislature has an appropriate role in solving one of these issues. But the other thing I learned a lot about is recruiting and retention. And so I'm very interested in knowing what the private sector is doing to help with these recruiting and retention issues, because they're going to be far better at it and have far better ideas than legislators ever could have. And they're going to have more resources and the most appropriate resources to apply to that issue or to that problem. So, that's one thing that I would be very interested in understanding, and there might be a role for us in there, but that's the first place that I'd want to look. Also very happy to hear about the pairing with the KNA, because I'm very interested in hearing from y'all, the people that are, in the trenches, as we used to say at Show, in the trenches working every day and seeing the issues up front. You guys, again, understand it better than anyone. So very happy to hear that program. And I hope at some point I can be paired with someone at the KNA, because that's a critical relationship.
Great. Well, and on this retention and recruiting and everything, and what the private sector is doing, it just goes back to what we're doing with this collaboration with KHA and the Kentucky Association of Healthcare Facilities to work on appropriate staffing levels in those facilities. So there's not the burnout, so that folks aren't having too many people, too many patients assigned at one time. So we are trying to collaborate with the private sector to try to solve these problems. And you're right, there are some times that the legislature does need to get involved. And so we appreciate your perspective.
And sorry, but whether it's solving an issue like the two I mentioned, or removing unnecessary regulation hurdles that are there that aren't there unnecessarily. So again, happy to hear what those things are.
Great, thank you. And Kim Moser, you never have anything to say on healthcare.
No, I have nothing to say. I love creating partnerships. I love that you all are always accessible. I try to be accessible to all of you. Certainly as a nurse, I understand your issues probably better than most, let's say. So I guess I would start. I've got a long list of things I could talk about here. So, in order to address the workforce shortage, we really need to take time to understand the reasons for it and the reasons for burnout. And so whether it's excessive workload, or if it's violence in the workplace, or if it's, just a lack of support, we need to understand that. We need to hear that from you all. So I was extremely proud to champion and pass the last two violence in the workplace pieces of legislation that passed and are making a huge difference. Also co-sponsor the decriminalization bill. I think that is critical. We have very, very few liability protections here in Kentucky for our healthcare workforce. And I think that we need to understand what that does to us. It is exploding litigation, of course, and sometimes it's warranted, and absolutely we are good with that. But if we have no liability protections, it really drives up the cost of healthcare as well. And so, we need to pay attention to that. The administrative burden. So many nurses and so many healthcare workers are being asked to do quality assurance for the hospitals and take on roles that really isn't part of our everyday workload. So I think that just understanding the reason for the burnout is a huge piece of what we can do. Back to the staffing ratios, I couldn't agree more. I mean, staffing ratios are a mandate that we just cannot meet without shutting down hospitals or long-term care facilities or others. It's the staffing needs change sometimes hourly. When I was practicing my nursing as a neonatal intensive care, I was sometimes on the ECMO team and over at Children's Hospital. Actually, it was on the ECMO team. And it was 2 nurses to 1 doctor for 1 patient. It's so critical. So you can't set these arbitrary numbers and ratios that really make no sense. It really does depend on the acuity of the patient. The faculty needs, I've heard this from many folks. I work with KCTCS quite a lot on their needs, and faculty pay it comes up routinely. So I think that there are a lot of things that we can be really proud of. We have worked on loan forgiveness programs, public-private partnership, which we just funded with $10 million for scholarships for nurses and other healthcare professionals. We also have additionally funded AHEC, the Area Health Education Coalition, and they are out working with junior high students and high school students to get them interested, to assess their readiness and willingness and interest in healthcare. And certainly if they're interested in healthcare, they are creating this beautiful mentorship all the way through their, whether it's nursing school, medical school, whatever it is. So we have done a lot in the healthcare space. I'm extremely proud of the work that we've done. And of course, we're going to keep working on access to care, alleviating barriers to care, and just working with you all. So thanks for everything you do.
Thank you. And that wraps up for this question.
Well, we are getting close to our time, Julie. So I'm wondering if Dolores and I should wrap up for the night. We want to be respectful of everyone's time. We appreciate people giving us this time this evening. Would that be okay with you, Julie?
Since you're the boss and I'm not, yes. No, I think that's appropriate. We
Thank
had such
you,
a
Jen.
great turnout tonight. We couldn't get
We
through all the
did.
questions,
It
and we
was
had some great
awesome.
interaction. So yes, no, that's perfectly fine.
You know, we weren't able to get through all the questions, especially some of the questions that are in the Q&A, but we do want to be respectful of everyone's time. So Dolores, who is my boss, is going to begin to take us home. Dolores?
Hello. All right. Thank you, Eleanor. I just want to again thank everyone for being here tonight. Those of you that are in the participant arena and those of you that are legislators and candidates, thank you so much for putting your time in tonight. As someone said earlier, this was great to get to know everybody a little bit and share our issues and concerns and hear from you and informed voting upcoming. And again, thank you to the GAC, the Governmental Affairs. This was a lot of work to put together, so I really appreciate you all. And, we usually go over a great list of upcoming events, but I definitely want to say for those of you that are nurses in the group that we have our annual business meeting coming up on September 26th. So please mark your calendar for that. I believe it's at 5 o'clock, Eleanor.
It is.
Okay, it's at 5 o'clock. It's virtual. And it's our annual meeting where we bring everybody together and go over our year in review and review our strategic plan. We do Nightingale tribute of nurses that have passed for the year and our bylaws review and voting. It's a wonderful evening of quite a few events. And we hope that you can make that to keep up to date with KNA work. And then Donna, Jeff.
Absolutely. As mentioned before, we have 3 more town halls that we will conduct, and hopefully we'll have a turnout just like this one, if not even better. We are doing Leadership and Advocacy Academy. We have 14 fellows, and that will begin October the 1st. We have our Leadership Retreat on October the 18th. We have something new and awesome that we're doing this year, first time in 118 years. We're doing a gala on November the 7th, and that will be in Northern Kentucky, guys. You guys should come and support the nurses. And then on the 8th, also in Northern Kentucky at St. E's Training Center, we will have our conference, which will be a hybrid, in-person and virtual. In February, we'll have Nurses Day at the Capitol, and many of you will be asked to come and talk with nurses. Last year, Julie says, we can't have any more nurses. We don't have any space. But the nurses were so excited and the students were so excited to go to Frankfurt and be able to meet with legislators and hear from legislators and also share with legislators. In May, we will have our legislative conference. And last year we had legislators who attended, the governor attended, and it was absolutely positively wonderful. So again, I say, thank you very much for your time. The KNA appreciates you. And if we can be of service in any way, if you go to our website, you can find my email address and certainly my phone number, and Dolores is there too. So good night and have a wonderful rest of your evening.